Now, let's look at some of the other species of chlamydia. They used to be called just chlamydia. Now they have changed the name to chlamydiophila, but that one's pretty easy to pick up on. First, I'm going to talk about C. pneumoniae, and then we'll look at psittaci. Chlamydiophila pneumoniae is one of the potential causes of walking pneumonia. And so it's going to be on a differential list or a distractor list if we're talking about the exam for walking pneumonia. But what's probably more prevalent than this is going to be Mycoplasma pneumoniae. All right? So you have chlamydia pneumoniae and Mycoplasma pneumoniae as two of the most common agents that cause walking pneumonia. Now, transmission for both of those is actually going to be respiratory droplets. And what is somewhat unique to chlamydiophila pneumoniae is there has been a link to atherosclerosis, and that's from the inflammation that is caused from the infection. So I'm going to skip down to the next slide so we can look at some of the other features here. So as far as the disease, again, we're talking walking pneumonia. What does that mean? Does that mean you're not really sick? No, you're actually pretty sick. But you can actually get yourself up out of bed and probably walk into school, walk into work, and infect everybody else around you. Whereas if you've got pneumonia from strep or from Klebsiella, there is no way you're getting up out of bed. You feel like there is a Buick laying on your chest. You can't really breathe. You've got a very, very high fever. Where in this case, you're not feeling really well. You've got a dry, hacking cough, sinusitis. You're going to be a little bit hoarse, but you can probably pick yourself up out of bed and get into work. Diagnosis here is serological. They're probably not going to tell you about the diagnosis. They're probably just going to want to know, with the presenting symptoms of this walking pneumonia, what are some of the most likely causes. And here we're going to treat with a macrolide, or we're going to treat it with a tetracycline. I'm going to go back to the beginning of this table and talk about Chlamydiophila psittaci. This we also call parrot fever, all right? So Chlamydiophila psittaci is also called parrot fever. And you get kind of this very severe respiratory infection, but it's a lot more severe because you can also get hepatitis. Now, what are the reservoirs? Of course, parrots, tropical birds, and believe me, I know you think the USMLE is an evil test, but for something like this, they mentioned the bird in the vignette. It's going to be a parrot, or in the United States, turkeys are a very large reservoir for Chlamydiophila psittaci. So you inhale the dried secretions, feces from the bird, and you inhale that into the respiratory tract, and you develop psittacosis. It is also an atypical pneumonia, but you can get hepatitis, which again makes this a little bit more serious. And this is very, very contagious. Serology, they're not going to tell you about. The treatment for Chlamydiophila psittaci is doxycycline. And what can we say? Prevention, you got to avoid the birds.